I'll be presenting today's Radiopedia.org case in radiology, diabetic myonecrosis. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 60-year-old male presenting with swelling and pain in the medial aspect of the right thigh for 2 months. The patient has a history of poorly controlled diabetes and diabetes-associated nephropathy, retinopathy, and peripheral vascular disease. On X-ray, we see that it's unremarkable, with the exception of the patient's atherosclerosis, which is noted here. On ultrasound, we see that there's induration of the vastus medialis muscle, as well as increased echogenicity and abnormality in the echo texture, which most probably represents edema. There's also subcutaneous edema in the thigh. On MRI, here T2-weighted imaging without contrast, we see that there's pronounced swelling of the vastus medialis muscle, particularly in the distal half. There's diffuse pathological signal of the muscle, heterogeneous in its distal part, probably evidence of loss of normal muscle architecture. This patient with painful muscle swelling and a patient with poorly controlled diabetes should raise suspicion for diabetic myonecrosis. Diabetic myonecrosis is an uncommon complication of diabetes, occurring in patients with chronic poor glycemic control. Patients present with acute onset of pain, tenderness, and swelling, more often in the lower limbs, with the thigh being the most common site. The exact cause is unknown, but diabetic myonecrosis is a skeletal muscle injury thought to be from atherosclerotic occlusion, hypoxia, reperfusion, or vasculitis with thrombus.